Hi, it's Noorhasan, host of the Modern Parenthood podcast. And May is Mental Health Awareness Month. And today I have Dr. Kanthi Raju with me here to talk about all things mental health. But before we get to talking about mental health and stress and its effect on infertility, I'm going to start off with 3 examples of the typical patients that I see coming to my office.
This podcast is meant to provide information on reproductive health. It does not establish a physician patient relationship, and we would urge you to contact your treating provider regarding your care.
You've all heard these stories before. Let's have a patient. Let's call her Samantha. She is a 36-year-old female. She and John have been married for about 8 years and actively trying to get pregnant for the last 4 years. Throughout their treatments, they've already had now 2 miscarriages. And in vitro fertilization with preimplantation genetic testing aneuploidy screening is recommended as the next step. So IVF, meaning making the embryos outside the body, and preimplantation genetic testing aneuploidy screening, testing the embryos for abnormalities like Down syndrome, Turner syndrome, trisomy 16, trisomy 18, monosomy X, genetic causes that can lead to miscarriages or failed implantation. Samantha and John are overwhelmed. They've been through several miscarriages. It's been many years of trying to get pregnant, and they don't know how to mentally make the next step. Let's talk about another patient, Jonathan and Jennifer. They've been trying for years to get pregnant, and they finally gave up and said, we're just going to adopt. And they adopted. They're happy. They're parents now by adoption. And a few months later, they get pregnant spontaneously. A third patient, Michelle and Matthew, they tried for many years to get pregnant and finally conceived on their first cycle of in vitro fertilization. After their daughter is born, they decided, oh, we don't need contraception. It's been hard for us to get pregnant. But Michelle gets pregnant 6 months after their daughter is born. We hear these stories over and over again. Once the stress is eliminated, somehow people have been able to get pregnant. We hear stories of doing fertility treatments and it becomes overwhelming. And how do you mentally make the next step happen for you? Well, Dr. Kanthi Raju is here with me today, and we're going to be talking all things mental health. So, Dr. Kanthi Raju, tell us a little bit about yourself.
Well, thank you, Dr. Noorhasan. Thank you so much for this opportunity to sit down and kind of talk with you about some really important issues regarding infertility and mental health. I'm Kanthi Raju. I'm a general adult psychiatrist. I've been in practice for over 27 years. I grew up in Mississippi, finished my undergraduate studies at Mississippi College before going to medical school at Des Moines University in Iowa. I actually started my training with the intent of being an internal medicine physician. But then during my first year of residency training, I realized that that wasn't my passion. Psychiatry was my passion. So I actually took a year off, spent time with my newborn at home, and transitioned into the psychiatry residency at UT Southwestern here in Dallas, and completed my training in 1999. As chief resident. After training, I worked as a medical director for a community mental health center here in Dallas for about 4 years before pursuing private practice. So my practice now is in Richardson, which is a suburb of Dallas. And I see a wide variety of adults with different psychiatric conditions, anywhere from major depressive disorder to schizophrenia. I really try to take kind of a collaborative, patient-centered approach to care, looking at a holistic treatment process, and I really enjoy collaborating with my patients, their families, other medical practitioners in really kind of personalized treatment plan for my patients. So I look forward to our discussion, and thank you again for this honor.
Absolutely. We're going to start off with something basic like telling our audience what is stress. Can you define what is stress?
Sure. Stress is not all bad. I mean, I think stress is kind of it's a natural process that our body has. It's a natural response to something that elicits, a biochemical and also physical and emotional response to a challenge to help us focus better and get through a difficult situation. Chronic stress can have an effect on our bodies and our mind. There's different types of stress. There's emotional stress, and of course, we're speaking about infertility treatments. Specifically to that, we have emotional stress, we have relationship stress, we have financial stress that can take a toll. And most of the time, we're talking about chronic stress taking a toll on infertility and fertility treatments. So that emotional stress is kind of like what we put on ourselves in that process of what are the expectations that we have on ourselves. Relationship stress, there can be guilt, there can be misconceptions, there can be misunderstandings about it, feeling less than. Financial stress, of course, is associated with the costs of treatment, blood work, lab work, appointments, and then, of course, there's workplace stress too. What's interesting is that about 84% of the general American public report work stress. And so then when you have infertility treatment added to that, you might have some missed days on top of the normal work stress. So, it's all kinds of stress that's involved. And I've read or I've heard from some couples that report sometimes the most stressful part or time is that waiting period after an embryo is transferred. So that's something I think that's also important to consider.
You've touched on so many important things just now, and I want to clarify for some of the audience. The stress, when I see patients who come to see me with infertility, it's the longing, waiting to have a baby, so the emotional stress. And fertility treatments are now being covered by more and more insurances, but still a large percentage of my patients still have to pay out of pocket. And so there becomes that financial stress. Many patients take second loans to do their fertility treatments. And these emotional stress, financial stress, relationship stress, they take these chances for a chance. It's not even a guarantee that the fertility treatments will work, for a chance. And that's how important having a child is for these couples. And the amount of stress, you're correct, that they have, the emotional, financial, relationship stress, plays a huge toll, and it's that chronic stress. And you also mentioned a very important aspect, that waiting period between your embryo transfer and will your pregnancy test be positive or negative. That is an incredibly long time period. It's about 10 to 14 days, but it could seem like months for some patients just waiting to find out if they're pregnant or not. I have some patients, they'll start checking urine pregnancy tests, and I tell them don't start too early because it's not going to be positive that early on. You have to wait for the right time. And but they really want to have a child, and that waiting time period is a significant time period where they're just stressed, waiting to see, will the test be positive or negative.
There were some comparative studies that looked at women undergoing fertility treatment and that level of stress and their symptoms, and they found them to actually be comparable to women who were undergoing cancer treatment or cardiac rehabilitation or even hypertension. So, oftentimes we think about, well, it's very simple to focus on mental health and, addressing symptoms for women who are going through severe medical issues like that. But I think it's important to recognize that because those symptoms can be very similar and they can occur in women undergoing fertility treatment, those very similar or same interventions are very important in women undergoing this and couples undergoing this.
Yes, can you tell us a little bit about the relationship issues that the stress brings along, as well as how this stress affects the male versus the female partner in different ways? I will tell you, as someone who's been practicing for a couple of decades now, I've seen marriages end after fertility treatments fail. So tell us a little bit about how men and women handle the stresses differently.
Well, oftentimes we talk about women undergoing stress during this time, but it's both. It's women and men. It's couples. Men can have that kind of oxidative stress that can decrease sperm health, and there's also that stress that can affect their libido, their sexual functioning, how they see themselves in terms of their self esteem, how they feel good about themselves. There's dynamics that they bring into the relationship. What was their kind of background in terms of how they saw family life with each other, even before they got together. So I think for women, there's certainly some symptoms to consider, but we see this in men as well, in terms of how they handle things. They may be a little more distant. They may pull back. You may see irritability. You may see an increase in alcohol or substance use associated with these symptoms in men.
You're absolutely correct. I notice sometimes the partners of my patients, they feel like they have to be strong for their partner who's undergoing these treatments because they're not the ones who are doing most of the treatments. And so, because they feel like they have to be strong for that partner, sometimes they don't allow themselves to be emotional about certain aspects of the treatment or even grief whether or not the pregnancy test was negative. Um, and so it's important to understand that partner plays a real role as well in terms of helping the partner or the patient with the pregnancy and understanding their role, but also they need emotional support. So the partner also needs emotional support as well.
That's correct. It is. I think it's important for couples to realize that it's healthy to give each other space to have those emotions, to be angry, to cry, to be emotional. It's okay to say no to a gathering or a family event. I think it's important to give yourself that space to acknowledge the emotions you're having, accept them, and work through them together, even together or even separately. I think it's really important to just give each other that safe space.
You mentioned something very important just now, events, family events. Many times I've heard this from patients. They cannot go to their friend's baby shower. They cannot be happy for their friend because their friend's pregnant and they're not, and they wanted to have a baby too. I hear from patients all the time the holidays are particularly difficult. Going to holiday parties, seeing friends and family who expected you to have a child by now, dealing with questions, well, when are you going to have a baby? Those events can be very stressful. And I absolutely agree with you. Sometimes you really do have to pick and choose which events you want to go to.
You do. It's, sometimes it can be helpful to have some kind of like rehearsed phrases and responses when those events pop up or those comments come into play. It's okay to say, oh, well, if someone asks, babies come when they come, or I've got a whole team working on that right now, or we are just enjoying time as it is right now. So I think it's important to, again, give yourself permission to decline invitations if you just don't feel up to it, or if you do go, how do you respond when someone asks a question about it, and have kind of practiced responses to that. I think those can be helpful too.
Fantastic. Dr. Raju, you mentioned in the beginning of this podcast stress as a normal reaction to dealing with something in our lives where we're struggling with it. And in some instances, it's great. It allows us to have that cortisol or stress steroid response to help us get through. But you're right, with the chronic stress, it does become an issue to constantly have to deal with this issue over and over, and the stress doesn't go away. Tell us, when does the stress become anxiety and depression?
So I think it's important to kind of think generally in terms of, women. Women do experience anxiety and depression more so than men. We were talking earlier about gender differences. The statistics are that 40 million Americans, or 20% of the population, report anxiety symptoms. Out of that, 80% of 80% of infertile women report depression or anxiety. And surprisingly, even though 10% of women who experience that report suicidal thoughts, less than 7% actually seek treatment. So this is such an important topic. It's important to have this awareness and to also understand when to seek treatment. When are these symptoms not just normal stress, but when does it actually become anxiety and depression? So in doing so, I think understanding some of the main symptoms and differences, thinking about the criteria for generalized anxiety disorder. So this is excessive worry occurring for greater than 6 months, or at least 6 months, that is impacting your daily level of functioning. It's causing physical symptoms, whether it's muscle tension, headaches, dizziness, changes in sleep, changes in appetite, changes in self-care. So that the primary indicator is that this is affecting your daily functioning. It's excessive daily worry. So that is the criteria for generalized anxiety. Looking at depression, about 48 million Americans and 30% of the general population have symptoms of depression. They report it. So again, it's important to recognize depression and to know what the criteria is for major depression. Sometimes it can be easy to kind of identify that with, there's a mnemonic that we use and we're taught in medical school for depression, SIG ECAPS, SIGECAPS, SIG ECAPS. So sadness, S standing for sadness, overall sadness, melancholy for most of the day, most days of the week. I, representing interest in things, a lack of interest in things, complete anhedonia, where you just are not interested in anything at all. G, representing guilt, feelings of guilt, worthlessness, and E, representing energy, changes in energy, typically low energy. C, representing concentration, poor concentration, difficulty focusing on things. A, representing appetite, changes in appetite. For some patients, it's an increase in appetite or a decrease in appetite or weight changes. P, representing psychomotor activity. Sometimes that can be psychomotor agitation, a sense of restlessness, or psychomotor retardation, where it's feeling slowed down, as if you're moving through life in molasses. And then S, the last one, representing suicidality. So it's an easy way to remember what those symptoms of depression are. SIG ECAPS, SIGECAPS. And then, of course, we talked about those symptoms that meet the criteria for generalized anxiety.
Fantastic. Tell us a little bit about how stress, anxiety, depression, fertility, as it relates to fertility, can be variable from person to person depending on socioeconomic status. We talked a lot earlier on about financials, and some people have insurance coverage, but others pay out of pocket. How does socioeconomic status play a role there? Cultural, different cultures see fertility different ways. In some cultures, having a male infant or having children pretty immediately after you're married is important for them. Tell us, as it relates to religion. I've had patients over the years of various religious denominations. One patient that sticks out in my mind was someone who was strictly Catholic, and they needed IVF treatments, but their religion prevented them from having IVF treatments. And how does one struggle internally with which choice do I make? And so tell us a little bit about what goes on in the psyche as it relates to fertility and the multiple environmental factors that affect us as well.
Yeah, that's a great point. Several points that you bring up. There are lots of factors. It's multifactorial in terms of societal pressures, personal pressures, cultural pressures. So, when we talk about societal pressures, even the media can have an influence, right? You see commercials that depict families as kind of the way to happiness in life. And so that puts a level of pressure on couples. You have cultural impacts as well, families of origin. And you're correct, in some cultures, having a family is a milestone in life. And some cultures, focus on more traditional or home remedies for infertility that can even delay medical intervention, delay treatment. So that can certainly have an impact on fertility treatment. And then you have your personal pressures in terms of, growing up in hearing in your household, oh, well, you're going to have a family one day, you're going to have children running around the house. So is that pressure that you even put on yourself as you grow older? And then you have this kind of FOMO, right? Fear of missing out, of having a family, having children. So I think that those are all different types of pressure that play a role on infertility. Stress, definitely.
And you bring up something very important. There are some people who choose to not be parents, and we see it all the time with the celebrities and the pressure that society puts on them that they chose not to do fertility treatments or chose not to be a parent, and how difficult that is because society wants everyone to, or it feels like society sees that we should have a family.
Yes, that's true. It is true. I think it's important for couples to, it's healthy to set boundaries, not only with others, but also with yourself. So it's important to say, in terms of setting those boundaries and saying to others, this is where we are in life. We're enjoying our time. Similar to what we discussed earlier in terms of having some rehearsed phrases and sentences. I think it's also important for couples to have self-compassion, understanding what their own needs are and their own stressors, taking care of themselves, finding joy in where they are in life at this time, even during the whole treatment process, finding those little joys in life, the little victories, and celebrating in those. I think also, focusing on mindfulness, meditation, healthy living, a healthy diet, exercise program, yoga, connecting as a couple, seeking others for support, maybe even other families that are going through something similar, other couples that are going through that. And then, of course, definitely seeking professional help to help deal with the stressors and the symptoms.
You brought up something very important, that is finding joy or finding gratitude. And that's so important. I hear this from my own fertility patients. So many times the majority go on and get pregnant and have babies, but there's some that don't. And I wish we had 100% pregnancy success rate. But I've heard this from many of my patients. Hey, we're glad we came and we did testing. At least we did testing and we got answers. And they're okay with that. And then I hear it from others, hey, I'm glad I did testing, I did treatments, I know it didn't work, but I'm at peace that I've tried. And that's so important with finding joy and gratitude wherever you are in whatever stage of treatments or stage of anything else in life that you're dealing with. I think that's very important. So thank you for bringing that up.
Of course, I agree. It is it is a stressful journey, but it can be a very rewarding journey, right? Of course, you know this. In terms of not just the process or the end result, if you are successful in having a child, but just even connecting as a couple or connecting with other couples during the process and making those lifelong friendships even. So I agree with you. I can hear other couples say that they found it rewarding in many ways.
Dr. Raju, we were talking about stress and recurrent pregnancy loss. And I described earlier on my mom, who lost two pregnancies, often say it would have been easier to not have been pregnant than to lose a child. And can you tell us a little bit about how stress affects recurrent pregnancy loss?
Yes. So, um, of course, infertility is the inability to get pregnant, and pregnancy loss can involve miscarriage and stillbirth. But together, it's considered reproductive trauma, both of them. And I think it's important to understand that with this can come grief and depression, but I think it's important to recognize the differences between grief and depression here. So grief can occur in waves, and oftentimes it can improve within 6 months of the loss or the trauma itself. But it's different from depression in that it is not all encompassing. It does not involve every aspect of a person's life and their daily functioning. It's it can be associated with a specific trauma or specific event, and in terms of managing that and understanding it, I think it's important to always speak with your physician about the emotions you're experiencing, the thought processes that you're having, to understand what's going on, and also to evaluate and see if there is a need for further intervention, and whether something else needs to be done to help with those symptoms.
Wonderful. Thank you, Dr. Raju, for being on the podcast. Y'all know I like to end the podcast with debunking some myths. So let's start with some myths here as it relates to mental health. The first is, if I just relax, I will get pregnant. And the fact is, that's not true. Otherwise, a bottle of wine and a beach vacation would fix everything. And so there are real physiological reasons why we don't get pregnant. And that's why it's important for you to see a reproductive endocrinologist and infertility specialist.
That's true.
Another myth that I want to debunk is, if I'm stressed, I will not ovulate. Well, we live in 2026 and there are lots of stressors right now, and we're all under stress. And it's just like Dr. Raju said, the chronic stress is what takes a toll on us, but daily stresses are part of part of our common day-to-day function. And so many people who are under day-to-day stresses are still ovulating. So if you're not ovulating, I would not chalk that up just to stress, and I would go see a fertility physician if you're struggling with ovulation.
So, one of the most common misconceptions that you had mentioned earlier, where that if you just relax, you can get pregnant. And for many people, that's actually that's a bit dismissive of patients' emotions and feelings about it. It, in some ways, invalidates their real life experiences associated with infertility and stress, and it minimizes their own experiences. And for some patients, it can make them feel guilty, or make them think of, well, am I not doing everything that I can for this process? So I think it has significant impact on patients to say, for even just the general public to say, well, if you relax, you're going to get pregnant. So I think you touched on a very important topic in terms of how to address that. I think for patients, it's important to recognize that they're doing all that they can for themselves, and it takes a great deal of focusing on themselves and their self-care, and understanding that it's a journey and it's a process, and seeking support from their professionals and their family and their community, I think, is important.
I want to thank Dr. Raju for being our guest today and talking about mental health and the struggles that our patients go through with fertility treatments and stress and the toll it takes on their mental health. This is Mental Health Awareness Month, and we will start off our next episode talking about treatment options for mental health as it relates to fertility treatments. So you don't want to miss the next episode. Please follow, like, and subscribe Modern Parenthood Podcast.
Pioneer.